Tonight on Eyewitness News at 5 o'clock, a test to see if you have a healthy heart. We're going to check in now with Gene Gleason live in Beverly Hills for a preview of that story. Gene?
Well, Michelle, modern medicine is full of high-tech machines. This is a brand new heart scanner. In a matter of seconds, it can give you an almost perfect three-dimension view of your heart. And coming up at 5, I will have my heart scanned just to tell you how it works. And by the end of the hour, we hope to have the results. We'll be back with that. Mark?
This is Eyewitness News at 5.
Well, heart disease, it's called the silent killer. It can strike without warning.
But an amazing new procedure is letting doctors literally see inside your heart to help predict your chance of getting a heart attack. Throughout the hour, Eyewitness News reporter Gene Gleason will be taking that test live, and he's standing by in Beverly Hills with a look at the new test that could save your life. Gene.
Well, David, Ellen, in the last half hour or so, Bob here has been prepping me to go into the big machine here. He's put an IV in this arm, and I have a blood pressure cuff on the other arm. I've got some wires attached around my body here. This machine happens to be the top-of-the-line heart scanner. It's the type of machine that they tell me can save your life someday. Now, if, for example, you worry about maybe a history of heart disease in your family, or you worry about the lifestyle you've been living, or you've been having chest pains, this is the kind of machine that in an hour can tell you with a three-dimensional picture of your heart just how healthy your heart is.
It's
a CT scanner and angiogram in one big machine. The technology to provide a clear three-dimensional view of the heart and its arteries has been developing for years, and now it's here.
What we have now that we didn't have before is the ability to look inside the arteries of the heart and not only see the heart plaque, the calcium that has been available for the last 4 or 5 years, but also the plaques that are younger, they're softer, and they're not calcified. In the past, we weren't able to see those plaques, and those are the dangerous ones.
Actor Saul Rubinek recently went through the scanner at Westside Medical Imaging. He had a heart stress test, but wasn't satisfied with the results.
The fear is, I guess, not wanting to be broadsided by anything in your life.
And were you?
Yes, I was. I was broadsided by the fact that as a middle-aged man, I didn't deserve to have the results that I had, which were that I had no arteriosclerosis, that I had a very healthy heart.
Rubinek got good news, but it's not always the case. Dr. Norman Lepore, co-director here, says a 59-year-old physician recently came in just for the peace of mind of knowing he's fit, but he wasn't.
Do I have coronary artery disease or do I not? And certainly this answers that question, whereas treadmill testing does not. Now, the problem with heart disease is that the first symptom of heart disease of a patient, for instance, having a heart attack is sudden death. So we're talking about a situation where we really want to prevent the first incident of coronary artery disease, which may come without warning and may be a mortal event.
Well, I've always considered myself healthy. I do a lot of exercise. I have a physical every year, and the doctor that I go to says I'm healthy. But we're going to find out whether my heart is as healthy as I think it is. The next time you see me, I will be inside this machine, and by the end of the hour, we should have the results. Whether or not any of that stuff we don't want is in the heart. We'll find out. Live in Beverly Hills, Gene Gleason, ABC 7 Eyewitness News. David Allen, back to you.
We are looking forward to this, Gene.
Yeah.
Thank you for that, and we'll see him a little bit later on in the hour.
And an amazing live event here on ABC 7 Eyewitness News, a heart test that can tell if trouble is in your future. Our own Gene Gleason gets the test here live. He's just about to go in. You'll see his results.
And a fascinating story coming your way. This is going to be a live report. That is Gene Gleason lying there, and he is going to put himself through a CT angiogram cardiac scanner. It's a state-of-the-art examination of your heart, and he'll even show us his results. That's coming up soon. It's an amazing new test for heart disease that lets doctors actually see inside your heart.
And Eyewitness News reporter Gene Gleason is undergoing that procedure right now with an update on this dramatic new test, one that could save your life. We go back to Gene live in Beverly Hills, California.
Well, you can see, you two, that I'm in the scanner right now, and in a moment I'm going to hear a woman's voice who's telling me to take a deep breath, and I'm going to have to do that as they scan my heart. And Jerry Free, who's the technology director here, okay, he's going to tell you what's happening.
Okay. We're doing a test now to watch the contrast come into the heart. There it is. It's coming into the aorta. This gives us the time.
Okay, now I can breathe again and I can talk some more. We're undergoing the scanner. It's a scan. It's very interesting because they put what they call a contrast through an IV into your bloodstream, and they have to time it just right for that contrast to go up into the heart at the moment that they do the scan. So you're going to hear this female voice ask me to take a deep breath again here in a second, so I may have to stop again. But while they do that, that scan takes a picture of your heart. It's very difficult to scan a heart because it's always pumping. That means it's always moving. So the technology times the picture it takes precisely to the moment when the heart is doing exactly what they want it to do, so that the picture is clear. The point here is to have a three-dimensional scan of your heart and all the arteries. And in a minute, now that they've taken the scan, we're going to find out how clean that heart is. Hopefully it's very clean. I'll throw it back to you while we wait for the results.
Oh, we know that Gene is very fit. I know that he gets, like he said, mentioned earlier, he gets a physical every year. He works out like a fiend. The guy can ride a bicycle like nobody.
Right.
So
Folks,
if he doesn't pass, we're all in trouble.
You'll see Gene doing miles over in Griffith Park on his bike, and that was a little cross-section of his heart you saw right there. And Gene will join us later on in the newscast to kind of analyze, and the doctors, of course, will analyze what they see in Gene's heart.
Just ahead on ABC7 Eyewitness News, the results of a life or death heart test.
The test just started on our colleague Gene Gleason minutes ago, and the results are ready. See it all next.
Well, could you be on the verge of a heart attack? An amazing new test could save your life.
Eyewitness News reporter Gene Gleason is undergoing that test right now. He joins us live in Beverly Hills to show us what it's like. Gene.
Well, we've done the test, and now we have the results already over here, and you can see my heart in 3D, and there's some good news and bad news. The good news is my heart is normal for somebody my age. Jerry, you're the technology expert, but there's some plaque there.
Well, there's some calcium, and the score is just average for what we would expect for someone your age. This is an artery on the left side of your heart. Here's another one. We're going to switch to another view where we can show the calcium that's in there.
And let me ask Dr. Norman Laporte while we're changing the view here. What happens is that, I mean, what should that tell me, that calcium buildup?
Well, the fact you have calcium buildup means you have some amount of atherosclerosis. So you have that disease process going on within your vessel. However, it's relatively mild. But even that being the case, we've actually been able to identify this disease early in its cause. And the recommendation, if I were your cardiologist, would be to initiate treatment to get the LDL cholesterol certainly less than 100 milligrams per deciliter. Just taking a pill like a statin would reduce your risk of having a heart attack based on this finding by 35 to 40%.
Okay, and looking at this is the kind of information that before would have been very difficult to get, and we've done it in 1 hour here.
Non-invasively, without any risk of having dislodged a plaque or anything else. You've got tremendous amount of information.
All right. Thank you, gentlemen, very much for the opportunity. It's been interesting, if not fun. And now we know a lot about what's going on inside my heart. Live in Beverly Hills, Gene Gleason, ABC7 Eyewitness News. Back to you guys.
That was fantastic and convenient. And Gene, you know, he really takes care of himself,
really
too. And it goes
does.
to show you that heredity is a very powerful thing.